Hello friends, pilonidal sinus. This is the disease about which I am going to talk today. Pilonidal sinus is a very nasty disease. It is found at the lowermost portion of the back in midline with multiple openings, lot of pain, pus formation, inflammation and inability for the patient to sit. The disease was discovered in 1867 and at that time it was thought to be congenital, and it took 57 years for the medical science to understand that the disease was not congenital, it was acquired. In 1924 it was proved that it is an acquired disease. I'll just first tell you the main cause of the disease, how it happens. Penetration of broken hair at the lowermost portion of the back near the coccyx in the midline. Now we must understand the mechanism and pathogenesis. What is the mechanism? What is the pathogenesis? Broken hair from all over the back, from nape of the neck to the anal orifice, get collected near the coccyx. And if there is a lot of moisture, they get penetrated mostly at the post-anal dimple. The disease was so common in World War II in the jeep drivers that it came to be called as jeep bottom. Coming to the epidemiology, once you have understood the mechanism and pathogenesis, it's very easy. It is found in young males between 20 to 30 years of age with lot of hair, active sodiferous glands. It is found less in females, more in those who are sitting for long hours and who have a post-anal dimple. The shape of the buttocks is also very important. If the shape is very deep, then also there is a lot of moisture present there. The disease is found in subjects who sit for long hours, especially on hard surfaces, and professionals who work in call centers or who are sitting for more than 12 to 14 hours in their office. What happens is, when there is a lot of moisture, the hair penetrate and form a sinus. The sinus gets infected. The hair gets sucked up due to intermittent negative pressures, and the sinus goes up in height towards the sacrum. It goes forwards also, but it never reaches the periosteum. There is side branching of the sinus also. Patient comes with excess pain, abscess formation, the abscess which breaks by itself and becomes alright by itself, but which never gets cured. There is a continuous irritation on the skin. The patient has a lot of difficulty in sitting and the disease never goes away. The patient comes quite late to us because there are no constitutional symptoms. The treatment which is practiced since last 60 to 70 years is a pure surgical treatment. Non-surgical treatment can be used only in very early cases where aseptic wash can cure the disease, but it never happens. The patient comes very late to us because the patient avoids coming to the doctor unless there is an abscess formation and excess inflammation. So we are left with only surgical treatment. Surgical treatment which is being practiced since last 60 to 70 years is excision of the sinus without primary closure and excision of the sinus with primary closure. When we excise the sinus, we put a dye and see that till where the tracks are going, and the sinus is excised. This procedure has got a good success rate, but it takes more than 5 weeks to heal. The patient cannot go back to work. There is a lot of antibiotics and NSAIDs which are required to make the patient pain-free and infection-free. Daily dressings are required, but the recurrence is not there and the success is good. In the second type of procedure, after the excision of sinus, the sinus is closed primarily, either in the midline or away from the midline by a rotation flap or advancement flap. But in this case also, the patient is disabled for 2 weeks till the stitches are removed, and the success rate is as low as 50%. So what to do with such a disease? Recently, a new technique is developed which is quite popular in the Western world, microsurgery. The technique involves cleaning of all the tracts by micro instruments, followed by an aseptic wash. And if this is done rightly, the disease cures. There is no pain, no antibiotics, no NSAIDs, no anesthesia. Follow-up is there every week to 10 days for up to 4 to 5 times. And the patient can go to his work the next day. Now coming to the prevention of disease. After knowing the mechanism, it's very easy. People with long sitting hours, people who are drivers sitting on hard surfaces, students sitting on wooden benches in the schools should avoid wearing tight clothes. They should wear loose clothes and keep the area shaved at regular intervals and keep the area dry, because our country is a very hot country with a lot of humid atmosphere. In the end, I would like to say that this new technique of microsurgery is a blessing for the patients, because no time is lost in the treatment. The patient goes immediately to work and time is money. The technique is purely patient oriented with more than 95% result. Thanks for the kind listening.